because the main reason that we've got you here is that we want to try to help practitioners stay longer and healthier in the industry. Can you tell us a little bit about how that works?
Well, I mean, just like performing artists and athletes, we overuse some muscles, we underuse others, right? So if we're not caring for our body and our minds as well, it can really be detrimental to our career, right? We can end up with repetitive strain injuries, overuse syndromes, and even just practicing a few minutes a day can make a huge difference. And if we want to do our best to help our patients, we really have to be feeling our best as well.
Yeah, I get that analogy of put your mask on first before you put the mask on for your children in an airplane, if we ever get on an airplane again.
It will happen.
Yeah. So primarily hands or necks and shoulders, how does it work?
Yeah, when I teach workshops on this, I address neck and shoulders as well as arms and hands. I mean, the hands are the more common place to experience an injury. There was some research done on manual therapists' injuries, and I think the study looked at chiropractors and massage therapists and physical therapists, and they found the most common injuries were in the thumb. So
that makes sense.
If that study had included shiatsu therapists, because we use primarily our thumbs to apply pressure, I'm sure the percentage of injuries in the thumb would have been much higher still.
Yeah, well, yeah. And you do, and like I've had Thai massage, and they tend to use the flats, the hand more than thumbs. But yeah, you were doing lots of. Is it you going through the ashi points, or vaguely remember that you actually really point specific along the body?
Exactly. And some styles of shiatsu use the elbow, but I don't. I only use my hands, and sometimes the heel of the hand as well, but primarily the thumbs.
Yeah. So can you give us some tips?
Sure. Well, I'm fortunate that I have a very short walk to work. It takes me 10 minutes to get from my front door to inside my treatment room. So I take advantage of that short walk to warm up my hands while I'm going to work. So I'll do stretching for my fingers and my wrists, and I'll do rotations of all of the joints as well. And I'll also do some self-shiatsu along the thenar eminence in particular, and between the first and second metacarpals and down the thumb and so on. So yeah, we can do some. Why not? So
yes, please.
I'm just going to shift my camera down a little so you can see my hand.
Okay.
So when you're doing shiatsu, you use the pad of the thumb or finger, not the tip. And you're going to try to keep your thumb extended when you're applying pressure rather than bending it. If you're bending it like that while you're applying pressure, you're going to really tire out the tendons. Okay. Right? Whereas if you keep it extended, you're relying more on the skeletal structure.